Hello, my name is Dr. Rajiv Lochan. I am the lead hepatobiliary and liver transplant surgeon here at Aster RV Hospital. I work with a large group of liver doctors and we call ourselves the Integrated Liver Care Group at Aster. Now, a lot of patients come to see me in the outpatients and they're quite surprised when I tell quite a few of them that they have stable cirrhosis and that they do not need a transplant. So I just want to address this question of what is cirrhosis and who needs a transplant. The most important thing to understand is that not all patients with cirrhosis or liver disease need a transplant. The liver is a wonderful organ. It has fantastic regenerative capabilities, and even though the liver is diseased, that is cirrhotic or has developed cirrhosis. By cirrhosis, we mean that there are some irreversible changes which have taken place in the liver and that we cannot get the liver back to normal. But still, the liver function might be adequate to maintain the day-to-day needs of the patient. So this condition we call as stable liver disease or stable cirrhosis. And when we calculate the MELD score, you can calculate the MELD, which is the MELD score on the internet. There is the OPTN or various calculators are available. When the score is between 8 to 12 or 13, we say that they are in the stable cirrhotic range. When people develop decompensated liver disease, that is when the cirrhotic liver is not able to sustain the day-to-day needs of the body, that is the MELD score goes more than 14 or 15, that is when we recommend that patients undergo a liver transplant. Now, when the score reaches 14 or 15, that is when the liver, which is the battery or the engine of the human body, is unable to supply the day-to-day energy needs. And this is when we cannot really improve the liver function, and this is the situation at which we label a patient or the diagnosis changes from cirrhosis to decompensated liver disease. And this is where the benefit of a liver transplant is much more than the medical treatment of liver disease. And these patients are ones who would need to see a liver unit and most likely will benefit from a liver transplant, which means replacing the diseased liver with a healthy liver. Now that leads us on to the next question as to where you would get this healthy organ from. Maybe we'll talk about that in a later snippet.